Well, it is time to get started. So we'd like to welcome everyone to another casual conversation series where I'm super excited to have Ann Newstead on today. And welcome, Ann. We actually know each other for several years now, and it's always such a joy to do anything with you. I will be providing Ann a brief introduction because I'd like to utilize the first part of this today, where you get to kind of share your story and your journey. But I will let our listeners know. So for those of you who might not know Ann, she's been practicing for more than 35 years. She's a physical therapist. She has her doctorate in physical therapy. She has a PhD. She has 2 clinical board certifications through the APTA in geriatrics and in neurology. And Ann also has her certificate of competency in vestibular rehab, and just a great example of a lifelong learner. Teaches on geriatrics, neuro, balance, dizziness, more specific vestibular, concussion, ethics, and has also spoke on today's topic about motivational interviewing. So we could have had you in for many different topics to speak about. So just thank you so much for joining us. Always a pleasure.
Thank you.
And we will also be providing our listeners with Ann's contact information. She's right now in private practice in San Antonio, Texas, has also educated healthcare providers, been an institutional teaching student, so just brings so much to the table about lifelong learning. So thank you, Ann, and welcome.
You're welcome. Thank you for having me here.
And you know the format of this, but I like to ask our speakers some similar questions to learn more about you, and what inspired you to become a physical therapist.
Well, that is nice that we get to reflect on this kind of topic, because I was running this morning and I was thinking, well, why did I become a physical therapist? And my sister told me I always wanted to be a physical therapist. And I remember as about a 7-year-old making my own crutches out of 2x4s, going around our sidewalk and our driveway, up and down, back and forth, because one of my classmates had polio. And that's how he got around on crutches. And I remember that very distinctly. And I never saw him in a wheelchair. He was always on those forearm crutches, which was amazing. And so that was part of it. The other thing that motivated me was I loved the physical part of the body, the human body. And then I had older parents, so they were in their 40s when I was born, and I honestly loved seeing them. They just seemed like they always were so young, even though they were older. They always seemed so young, and I was wondering, how do people stay young and active for most of their lives? And that inspired me a lot.
Well, and you do that still in your practice today. I mean, you obviously are a rehab therapist, but you promote fitness and wellness equally.
Yeah.
And I think it's just such a great tie into what we're going to talk about today in, motivational interviewing, and how it's, I don't want to jump into any questions that we've too early, but certainly the importance of that empowerment, not just in what we teach someone to do at home, but in how we communicate. So I'm so excited to have you here to talk about this. So, started out as physical therapy. What was your journey from like doctor of physical therapy to, like PhD? You first, did you first go into neurology, board certified, and then do geriatrics? What was your journey around that?
So my journey was, I really knew I loved neuro rehab from my school work at UAB, University of Alabama in Birmingham. So I sought out a rehab clinical and then knew I fell in love with it. Started doing rehab at TIER in Houston. And then about 15 years out, I ended up in education, teaching neuro rehab. And so first I wanted to do was I wanted to get my certification in neuro rehab. It was a perfect timing for me. So that was about 15 years out of school. And then about 10 years later, I sought out geriatrics because I was doing a lot of home care, because in teaching, I could do home care very easily, and decided to get my specialization in geriatrics. And then I had no interest in getting my PhD, but I was teaching, and there was a kind of a call for us to get our PhDs if we're going to stay in academics. So I did, and then I turned around and got my DPT, my clinical doctor of physical therapy. So I kind of did it in the reverse. I was working in the gait and movement analysis lab at UT Health Science Center, and that inspired me to go on for my PhD to learn more about kinesiology, which is what my PhD is in.
Well, and it's just amazing how well-rounded you are in the educational and practicing space. Do you have any advice for the less seasoned therapists, like the students coming out into the physical therapy world as we know it? It's been evolving as we know it today.
Yeah, my advice is love what you do. Then you're not really working, right? If you go in, you're finding yourself kind of in a rut, look around and say, what really motivates me? What really touches me? What inspires you each and every day? And if you can find that niche, that is the end all, I think. Then you might have to reinvent that from time to time. From time to time, we need a little recharging. And seeking out the knowledge each and every day, seeking out knowledge of people that come in. I don't have all the answers, and so I continually seek that information. So to keep it fresh, find a new way to learn about what's going on with your patients, but also finding mentors, people that can mentor you, that can kind of lead you in the right direction, or that you can consult, even if it's calling up a former professor. I get those calls from time to time. Or finding a place to work that has people that are willing to mentor you, willing to take you under their wings.
And, even mentorship, embracing that, teaching people more on the vestibular, more on geriatrics, more on wellness, more on motivational interviewing. And then also in the more seasoned, I can't imagine not having colleagues to reach out to, or, whether it's staff in the clinic, reaching out to you when you have we have complicated cases. And I feel like this, particularly in the patient population of vestibular rehab, but this could be in chronic pain. This applies to a lot of different patient population. But any advice besides, keeping it fresh, learning something new, to the more seasoned therapist who may be experiencing some concerns of burnout? Even, after this last year and a half with COVID, it does seem like patients are coming in a little bit more complicated, more maybe looking like 3PD, chronic dizziness, even for someone with this classic. Do you have any advice on that?
Yeah, I wish I had the magic wand, but what comes to mind first is take one thing at a time. Treat the human, and maybe take the easiest thing first. Get that taken care of. And I'm going to emphasize a little bit of this today, and that is to listen to the person. They're going to tell you what needs to be taken care of. if you really take that, especially in that first visit or two, take some time for that individual. And as I guess I'm sort of seasoned. You know, I feel like I'm learning something from my patients every day. In fact, a woman came in today with, she's dizzy, and I second time I've seen her. She's in her 80s, and I'm sure her doctor told her that, that's normal part of aging, which we know it isn't. And so I did further testing with her today, only to discover that, my evaluation my exam is not done with her. I still need to do further testing every time she comes in. And so, yes, I think being able to go and consult with your colleagues, or seek out someone that you took a course from, or go take another course. You think you know it all, but you may not. I always come away with at least 1 or 2 tidbits from a new course. I just finished taking a course in functional nutrition. And a lot of times I ask people a lot of information about their diets, about their sleep. So kind of expanding your knowledge base. It's not to say we're an expert in everything. We're in being willing to continually learn and seek out that information. I'm not sure I'm answering your question, but for me,
I think that's, I learn something every time I see, patients. So, sometimes it's, you start to think about life changes, focusing on education, coming out of patient care. And then there's this thing about patient care that's like, but I've learned so much, not necessarily about what I did right, but things I missed. And, always having that kind of fear of not having the opportunity to learn something. You definitely, I think, have to embrace there's a lot of unknowns, but that's what keeps me motivated. So I love to ask all of our guests these questions. So you've already said that, patients are somewhat an inspiration because you learn from them. Throughout your career, have there been any kind of other aha moments that you've had?
Yeah, I've had quite a few aha moments. As I was thinking about my thinking about this presentation today, or our discussion today, my aha moment is you don't have to be perfect. You don't have to have all the answers. I don't have all the answers, and admitting when you don't, but you'll help that person seek out the information that you need. So as you mentioned, many of our patients are coming in more complex, and they have maybe that one key that you have to help them unlock. And through unlocking that key, you're both learning. We're both growing. And so once again, I think the biggest aha I have is I don't have to have all the answers. It's okay to say, I don't know. Let's search that out.
And thank you, I think, just, for emphasizing that, because there is a lot of pressure to know. And I think getting comfortable with, we know what we know what we don't know, and then there's even more we don't know what we don't know. So just also that inspiration to keep learning from each other. And as we provide education, so much of that is on skills, how to perform a vestibular exam, a balance exam, a neuro eval. And certainly having you here, there's this bias because I know you and what you bring to the table as a therapist, as an educational provider, but also that your interest in motivational interviewing, because that's a different skill. And I think before we move on to some of the questions we've received from the audience, I'm not fully aware what people know about motivational interviewing. Like, I got this book and fell in love with the content because, when we always talk about the importance of the subjective, the importance of the intake, and that is gathering data on the characteristics of dizziness to better understand what's going on. This is a different perspective motivational interviewing. So I would love it if you could take a few minutes to let our listeners know what is motivational interviewing in healthcare.
Very good. So I can give you the functional definition according to the motivational interviewing experts. And that is, it's a collaborative, goal-oriented style of communication. And communication is the key word, as well as collaborative, with particular attention to the language of change. So is the person that's coming in to see you ready for change, the readiness for change? It's designed to strengthen the personal motivation for, so there's the word motivation, and commitment to a specific goal. So we presume patients want to get rid of their dizziness if they're coming in with dizziness problems. And by the time they come in, hopefully they have a commitment to getting rid of that dizziness and maybe lightheadedness, by eliciting and exploring the person's own reasons for change. So we've got to explore those reasons for change within an atmosphere of acceptance and compassion, of trust, building a trusting relationship, accepting the person, giving the person autonomy, giving the person a chance to voice what their concerns are, what their goals are, and helping them move from, really nurturing the person and moving them to understand what's going on. Because in motivational interviewing, the person has the elements, it's an understanding, it's our position or our opportunity to help them work through all of the challenges that they have. They have the key within themselves to turn that key and move forward to taking action. But the first step really is building that partnership, building that communication, building that collaboration, and believing in the patient and their ability to improve themselves.
Well, and you use some really powerful words, well, obviously communication is key, and collaboration and compassion. Such important, empowering words in likely any population with chronic symptoms, and developing that trust from their healthcare provider. So I think it's just an awesome opportunity that we have. Thank you for that. Thank you so much for that explanation. Yeah, go ahead.
Insight that maybe people will think about, and that is, this takes time. And because of our healthcare system, which you kind of mentioned, we know there's a lot of changes, and you have to do everything and consolidate everything into such a short period of time. Get your history, get going, get a treatment plan, move on to the next person. And so it does take time. But I think that time on that first visit or two is the most important time for us to build those relationships, to collaborate. And so the spirit of motivational interviewing is collaboration, compassion, that trust, that acceptance, and then to evoke the responses and decisions and action plan that those persons want to engage in. It's not forcing, it's not, in fact, I think it's finding the positives in the person that we can bring out of them through taking that time. And the time factor is definitely a challenge.
It certainly is. I'm not always completely grateful about the reimbursement rates that we have in healthcare, but one thing I just love about our profession is that we're time-based in reimbursement. So it's, we can spend time with patients. We can spend time 30, 45 minutes, an hour with patients, and that is so important to have this ongoing evaluation, ongoing, guidance, learning, trust, and then feeding that back to the physician who isn't getting paid for that much time with patients, which has hurt the healthcare system, because so much of it is when we have time to listen, it makes such a huge difference. Well, thank you for that. I think, that helps set up the stage for particularly the questions, and I'll put everyone else's questions first, because I certainly have my own. And you've already addressed this one. I'm not familiar with motivational interviewing. Can you explain, which you just did? Do you think motivational interviewing, does it increase the buy-in to the patient's care plan?
I have to say that I would say a qualified yes. The reason I'm saying qualified yes is to negotiate motivational interviewing. It's every time you see the patient. And so it means we need to stay aware of ourselves and our agenda each and every time we see the patient, because we may, one day we may not be really on top of our games, and another day we might be a little bit more astute and a little more listening, and a little bit more compassionate. So I would say a qualified yes, in terms of the literature is saying that people are more adherent to their programs if we can engage persons in finding their own solutions to their problem, so that they can then carry out the action plan.
And that actually ties in perfectly to one of the questions, because you just mentioned the research says, because one of the questions is motivational interviewing, also called MI, is it evidence-based specifically in the healthcare setting? And if so, is there research that shows it increases outcomes?
Yeah, so when I did a quick lit search on this, updated lit search on this topic of MI, motivational interviewing, I found that there are over 5,000 articles, and many of them are in healthcare arena. Some of them are in the mental health care arena. Some of them are in type 2 diabetes, medication, chronic disease, asthma. Those are some of the areas that I noticed that had, quite a few articles in. So this started out in terms of addiction and people with drug and alcohol abuse problems. And so this is evolved because we know that healthcare is more than just physical. It is also well-being. And so it is a good takeoff. Now, Lynn, my colleague that I presented with at conference a few years ago, she did her motivational interviewing on people with type 2 diabetes in terms of, all of the above, from nutrition to exercise to, just how they felt about the disease process being newly diagnosed. And she did find positive results in that. That was part of her PhD work. And so from that, what I learned is that people can actually internalize and make that change to wanting to act, not being told to act, but having the freedom or autonomy to choose to act, not being forced into anything. we want, or not convincing, but them convincing themselves. And she just used little paper stickers, stickies, where the person had language at the beginning of their motivational interviewing process and at the end. And their language turned from a lot of negative terms to positive terms.
Interesting.
Yeah, it is interesting. So.
And actually, one of the questions kind of later down my list here is really some samples, but so can you provide some examples of motivational interviewing questions or responses, or is it a combination of both? And then this person elaborates. For example, a couple of common questions that I get from patients are, I just have so much going on that I can't do my exercises every day, or I can't afford for my exercises to make me dizzy. I have too much to take care of between home and work. It's interesting to hear these questions, because something you said earlier was about when the patient is ready for change. What if, like, when I hear this, I don't hear that person is, maybe they're ready for change, but I hear resistance. And so if you want to, again, can you provide some examples of motivational interviewing questions? What about responses? And then these are just two common things that this therapist hears from their patients. I have so much going on, I can't do it every day. Or I just can't afford to do these exercises, they make me dizzy. You have any recommendations on how you would respond to that?
Oh, yes, I make up answers to that all the time. So just to start, there are some 5 basic questions that we can use that's in motivational interviewing. So asking somebody these 5 questions: why would you want to make this change? So the why question. How might you go ahead to make the change in order to succeed? And I can send you these, Bridgett. What are the best 3 reasons for you to do that change, to make that change? And then 4, how important is it for you to make that change today? And then lastly, what do you think you will do to make that change? So it's really person-centered or human-centered spirit, giving them the responsibility. Now, time is always a big factor. So I actually time the people. I take my clock out, I time them to see how long it takes them to do their exercises. And I've done this with a few people that have given me this. And, I go, well, do you think you have 10 minutes 3 times a day to do your eye-head coordination exercises? And they're like, man, it's okay, yeah, I do. So I'm trying to be more aware. I am more aware that people have their lives. The other thing is that asking a person or helping them, I'm using this more and more, how can you incorporate this into real life? So how can you incorporate these activities into real life? One gentleman that is using the laser, he goes, oh yeah, I have the laser on in my, I use it in my garage when I'm working, and I just trace whatever I see in my garage with the laser. I'm like, hey, whatever, this is great. Yeah, I gave him a bullseye and everything, but he is being innovative. That is something he thought of himself. It's working. And I'm like, that's great. So people that just in the last 2 days, 3 people have come to me and said, I've learned to integrate into my daily schedule. Therefore, it doesn't seem like exercise. It's more of an activity. So an activity that makes me feel better. Actually, they respond by saying it's making them feel better. So making sure that it's not like a 5-hour program like it was when I first started out, when I first graduated from physical therapy school, and making it reasonable and doable. Now, affording the dizziness. So that is something that I can totally understand. So building the activities into the day such that they can't afford not to do the activities. So helping them to understand, maybe giving them an article. I've done this with a few people on how they have to keep this up the rest of their lives so that they can keep moving, they can stay functional, they can stay engaged in their world. So motivational interviewing principles state that we can give them our expert opinion. We're not going to force it on them. They may need to learn that when they stop doing the activities or exercises, that they get that there's worsening or they go backwards. So we may have to let them fail a little bit so that they can succeed.
Mm-hmm. All right, that's awesome. Those are some great take-home points. So thank you for that. We've got another question. Do you develop, well, this, you just kind of answered this. Develop your patient's home programs based on information you observed during your evaluation. For instance, okay, I see what this question is. It's more like how you might instruct someone. For instance, I find some patients want very clear and concise instructions, like engineers, while others want options. I'm an options person. Is there a tool or screening questionnaire that I can give to patients, or something, that you would use in the clinic on what's the best way to communicate with this patient?
Well, we all know that we need to be adaptable with the patient's style of learning. I will actually say I don't have a formalized tool for that, but so this is about a 3-part question. First off, I just give them one thing at a time to start with, so they can get really good at that one thing. Then I can also see the next time I see them, or I can evaluate the next time I see them, whether or not that's worked or not. And then I can upgrade that one thing and maybe add another item onto that. So I start with this, like I said, I start with the simplest, and then I build on that so that I feel that they're not overwhelmed. Mm-hmm. Some people can take more than that, others not so much. The engineers in the group, I can give them all of the background, the angle of deviation, right and left, and we can talk that language, and I can give them more information about that. The people that need a little different flow, I can always give them a handout, which then I know what they've done, but I can also then use other pictures or maybe other resources to enhance that. Now, taking that a step further, I also send them away with a piece of paper that has, I've adapted a 7-day pain scale on to 7-day either nutrition or a dizziness index. So I send them away and ask them, please write on this piece of paper what you've done and then how you felt. On a scale of 0 to 5, how much was your dizziness? Or what was your food intake? I want to do a nutrition profile for a week. If they only do 2 days, that's better than none. Mm-hmm. So I'm collecting information, and then by writing it down, they're reflecting on how they're doing. That is giving them more responsibility, which is the autonomy part of all of this motivational interviewing. And they go away, and if they internalize it and think, I'm more guiding them then. I can guide them better. I'm not directing, I'm not laying back and saying, good luck, I'm here, but I'm sort of guiding them in the right direction once I know what's working for them. If they come back and say, that home exercise program, I just threw it in the garbage can, or I used it for burning purposes for my trip, and we can start over. But that usually doesn't happen. We need to speak that person's language. And I think keeping one thing at a time is the way I've learned the hard way, after giving people books of exercises is then I know better what's going on. But also I have some people that are more complex that have more of that overlay of psychosocial stress and trials and tribulations about being dizzy. And so through giving them this piece of paper to mark down their dizziness, I had one woman that went from dizzy all the time to maybe being dizzy 2 out of 5 once a week. And she would emphasize the negative. I was so dizzy Tuesday. And I said, but you weren't dizzy 6 other days of the week. Does that make sense?
Yeah, that's perfect.
So I've been working more towards empowering, more open-ended questions, engaging, helping them to understand the process, but me to understand them.
Right.
Probably more important through listening, through sort of evoking motivation from them. So that is getting them to talk about changing in the improvements they made rather than staying the same. So it really comes down to giving, adding to their body's bank account.
I love that.
I forget where I came up with that, but I'm sure it was not a novel idea, but I was just thinking, okay, every time you do exercise, every time you do an activity that maybe it provokes dizziness, but then it's adding to your bank account. And maybe they're doing too much. I've had a few people come in that were much worse. Well, we overdid it. Okay, let's back off. Anybody ever had that problem happen?
Oh yeah. I've made some assumptions with athletes post concussion about being able to do exercises. So I think, we've seen for us this transition of, yes, we want you to be aware of your symptoms, but how quickly do you recover? And just using the recovery word is super, super important.
I also use the word healing. I like recovery. But, this whole positive word use is so important. So many people come in, oh, it's killing me. I said, well, do we need to call 911?
Right.
Not being, being a little sarcastic, but trying not to be too sarcastic because you've already built that trust, that respect.
Right.
Anyway, yeah, it's a recovery process, and it does
really, and it fluctuates, and I think that's hard for patients. And just, what's the weather doing? What's your sleep? What's your food? What's the stress in your life? And it's okay to 2 steps back. We can just rest, and still there's all this room for recovery. So just for those of you that may have signed on a little later, this is Motivational Interviewing in Healthcare. We'll provide you to the link to this book. There is a question, Ann, do you have any recommendations for further training on motivational interviewing?
So there are some motivational interviewing courses out there. Joe, I think it's Tatta, Tatta, offers one online. I have not taken this course. I've not taken any courses on motivational interviewing. I've just kind of learned from reading and doing. There are books online, like Bridgett mentioned. There's some good websites. I can send you those references, Bridgett, and you can forward it to folks. One of the websites I found were that motivational interviewing set of skills, the core elements of motivational interviewing. And that was a good website. It synopses everything pretty nicely. I can send you that. But they talk about core skills of OARS. O standing for open-ended questions. A standing for affirmations. How many people like to be affirmed? Finding their strengths. Past successes, we all like that, right? R standing for reflections based on our careful listening to the human that is behind that body. And then summarizing and understanding that reinforces them, moving forward, and the key points that we want, they want to get across. They want to get across. This is their journey. We're there to be guiding them through the process, through the journey. So, and through summarizing, that helps them know that we're listening, that we're on the journey with them. We're there to support them. So it's an exchange of information, free floating, and we're really focusing on the language of change moving towards a person really healing, like we were saying, through their recovery process. And the journey may be up and down. Sometimes I have people that come in much worse, and I go, I messed up. Where did I mess up? I always look at home base first. What do we need to do to change that? So I hope that answers your question some.
And and just to go back to something you said about open-ended questions, and I do see open-ended questions as guided questions, and because our target audience is in the vestibular world, it's just to reiterate, open-ended questions of which the answer is not going to be yes or no, but an open-ended question that allows them to express themselves, whether, not are you dizzy, but can you describe your dizziness without using the word dizzy? So I do encourage to ask guided open-ended questions, or just as a rule of thumb, not that yes or no answer, because some patients, if you say, do busy places make you dizzy? No. Okay, if you stop there, then you might think that busy places don't make them dizzy, but they'll say they don't because I don't go to busy places. Why? So why don't you go to busy places? Because they make me dizzy. So it's just the open-ended question with a little bit of direction. Okay.
Exactly. And another good response there is tell me more. Because they don't know. We're not in their bodies. We're not mind readers. And if they don't know how to explain it, well, maybe you can draw it, if they're an artist. But just keep digging, and but not in a forceful way, in a a respectful, really seeking to understand way.
And I have a question here, Ann, and I don't know if there is an answer, but in the vestibular world, it is emphasized over and over about how important the intake is. So we've got how important the intake is and how important it is to listen. Like we're listening about characteristics, but we're also listening to understand, which is the beauty of motivational interviewing. So my question is, when we put so much emphasis on this to identify the diagnosis, customize their care plan, do you have any advice? Because you've just taught so many different across the professional span, from students to advanced to different disciplines. Do you have any advice on when you can't verbalize it? And then what triggered that is you just said have them draw it. But if you've worked with patients with dementia, or you've worked in, where the person cannot express. So if we're trying to gather information and listen, do you have any advice on when the patient cannot physically express or mentally express? Do you have any thoughts on that?
Observe. Yeah, I'd hate to make it sound so simple, but
sure.
So when let's say you're doing a head shake nystagmus test, and the person's like, well, I were you dizzy? But well, something went on in my head.
Yeah.
Right. Okay, whatever, I'm just making it up. But so you know that something isn't right there by the look on their face, by their eyes blinking, maybe their eyes watering. They can't communicate. Maybe they've had a stroke, a brain injury, a concussion. Maybe they have ALS. You know, there's all sorts of different diagnoses that this, or MS, that might have dizziness, difficulties with dizziness or imbalance or disequilibrium or lightheadedness. So, and then working on possibility of, I mean, we all try to reproduce the problem, right? Which the patient loves. You know, to an extent, right? But ruling out things like, is it hypotension, postural hypotension? Is that interfering with some of what we're going on here? So some of it doesn't have to be said per se. Or maybe, when does this happen? Because people are telling you, and I think I learned this from you, Bridgett, people are telling you, when I roll over in bed, you know, this happens. Or when I put, one guy comes in, when I put my eye drops in, I get dizziness, right? So he may not be able to totally describe it. Well, which way is the room spinning? I might ask, well, which way is the room? Can't tell me. You know, you can't tell me this way or going that way, or, you know, nothing about it, right? And so, yeah, I when I said, or draw it, I still think observation, we're good at observing, but that does also take keying in and being astute to what's going on with that individual.
Yeah, and it may even be posturing, because I mean, none of us like the mask, right? This has been a challenge, but losing the observation of the eyes can tell a lot, but the observation of what happens here it's been challenging. You know, it's because you may ask a question and see someone's response around their face. So I think that has been, I will say personally, it's been a challenging over the last year and a half, is the mask and not being able to observe those facial expressions. Well, thank you.
There's a few people, yeah, I'm sorry, go ahead.
No, you go ahead.
There's a few people I will put I'll put a mask on, and I have a shield, and I may let them to go ahead and take off their mask. One, and treat them that way, so I can see what's going on with their face. Putting goggles over a mask and all that is kind of complicated.
Yeah, it's been very problematic for sure.
Yeah, we're being very adaptable right now, but thank you for sharing your insights as well. Any other questions?
I haven't seen, you know, someone unfortunately had to drop off the call, but we'll be watching the recording, and just said thank you so much. They're interested in learning more about motivational interviewing. Thank you, Ann, as always. I look forward to collaborating with you in the future. We'll be sharing your contact information with our listeners as well. And again, I'll be providing some links about motivational interviewing in healthcare, some courses you can take. And as Ann said, she'll be sharing some additional resources for us. So I do want to thank everyone. Thank you, Ann. And if we do get some questions after this, I'll certainly forward them on to you.
Wonderful. I enjoyed it, and thank you so much for this opportunity.
All right, it's lucky us.
Okay.
All right, thank you so much.
Thank you. Hi, Louise. See y'all later.
Bye-bye.